Thank you, Mr. Chairman. Clearly, with the arrival of Ebola in the United States, we are all in this committee really concerned about whether or not our emergency preparedness systems are effective and whether our public health system is an effective response mechanism. And I think I share with everyone in this committee that we're concerned that we've seen protocols have to be adjusted, that we wish we'd had better training, that we're concerned about hospital responses. I would just add, particularly after the last statements, and I don't disagree that we want the highest standard of response, but a multitude of responses that are not based on scientific evidence and best practices, if they're not they aren't sound, then we create even more confusion and more panic by individuals, and we can't really manage a public health or an emergency systems response. Those are clear lessons that I learned as the Secretary of Health dealing with, I wasn't there to deal with hantavirus in New Mexico, but we had those experts certainly there. But I was there for SARS, for potential pandemics, for not having enough flu vaccine, and I'm still there dealing with one of the worst hepatitis C issues in the United States. So unfortunately in New Mexico, we know how important it is to have a good, solid, strong public health and emergency response system. To that end, I know that we've been both critical and we've recognized that whether or not Congress invests sufficient resources in the CDC and the NIH and all of our other partners that have a response to emergency preparedness, we expect that there is still in place a robust response. But I want to be clear that has the fact that these policymakers have failed Congress to invest appropriately and have cut funding, has that had a negative, Dr. Lurie, has that had a negative impact on our ability to respond not only to Ebola, but all public health crises?
No, I think that, we've seen an erosion in support for public health at several times in our country's history. And each time that happens, we look back through the retrospectoscope and wish we had done something different.
So I'm not sure I understand your answer. So you don't think that having reduced resources targeted at these issues has had any negative impact?
So we actually just had the opportunity to serve.
Because I will tell you that my public health team will say it is. My hospital says it is. Yep. That individual hospitals around the country say it is. And the fact that you have a decentralized public health system, so even if you had the authority to mandate, you don't have a system that you could do a mandate. And I don't know that I agree, although I really respect my colleague, Mr. Connolly, that you want to mandate here. But we have another issue in this country, which is we do not have a centralized public health system. Your ability to manage state by state by state by state, and I have a poor state with a centralized system, fairly effective, but I can tell you even there it was hard for us to manage all of our county emergency response partners in a crisis.
You're absolutely correct. And certainly we are hearing a lot from states that they are very concerned about the reductions in support for public health and for public health preparedness. And many of them are really looking hard at how they're going to have to cope with the latest rounds of reductions.
And are you prepared now to really think about best practices and more centralized approaches and requiring maybe a different protocol for our public health and emergency response systems in this country? I think if we did that, even when Congress doesn't do its job to adequately fund for these public health issues so that we only react when there's a crisis instead of, and I appreciate someone talking about precautionary principles, that we ought to be proactive in as many cases as we can where the evidence is sound about being proactive in that particular manner. But in fact, I do expect that the federal government, even with limited resources, does everything it can to identify what those best practices are and to regularly identify what the risks are if you don't adequately fund and what the impact is to states who also find themselves without resources to prepare and be trained effectively.
I so much appreciate your passion for public health and for the resourcing of public health. It's so important. The way public health is organized in this country by law is that the federal government, by and large, can provide guidance and tools and best practices, but the implementation of other aspects of public health is either at a state or local level. And as I think you know well, it's organized differently in different states.
Right.
Some
But
states-
that's my point, is it may be time to think about whether or not that in and of itself is an effective strategy in this country.
I think it's a very interesting idea.
Thank you.
Gentlelady's time.
I yield back.
expired. Thank the gentlelady.